I am from India. I'm 63 years old, and I came to this country when I was 29. I was a college professor who decided to become a primary school teacher, and I was there for 20 years, loving every moment of it.
Here's my story. I was so busy being a foster parent and a wife, and had a sick husband, and just taking care of everybody, just pouring into everybody and not pouring into myself.
I had the same doctor my whole entire childhood. And then moving into college, I didn't know what to expect, but my student health center was great. And I was able to have kind of the same two nurse practitioners for my entire 3.5-ish years. I could message, I could call, and I really had that relationship. Then I graduated, and I was kind of set out to find my own primary care doctor for the first time in my life.
I have had issues with health since I was a child. I was 16 with high blood pressure. I had diabetes. I was trying to take care of it, but it wasn't always taken care of. So it allowed for more things to happen to me, like dialysis.
I raised my children on my own, and knowing that I've overcome what I've overcome, I want to be able to empower my patients the same way. I have a passion. I'm very empathetic when it comes to their needs, and it's just rewarding in every way. Just being able to walk with patients on the walks of their lives.
Somewhere along the way, I realized that I wanted to be taking care of people long term. So just being able to take care of someone for a day or a week or a month was great and really rewarding, but not as fulfilling as being able to watch somebody along their health journey for years. And so that's how I ended up with primary care.
I started my relationship with my primary care physician in 1993, and I had her as my primary care physician for 30 years till she retired. She was not only my primary care physician, but she was also the physician for my two sons. But even though they went to college and everything, they would come back. Well, it was like visiting family. But then slowly, things started changing. Every time I went in, I would see a different nurse. They would be like, 1, 2, 3, 4, we're done, we're gone. And I could see it was taking a toll on my physician, and the connection was not there anymore.
It was, a new insurance, and that dance of no one could see me 2 weeks, 3 weeks, 4 weeks out. And eventually I did find a primary care, but if I was sick and I needed to someone, in a day or 2 days, I had strep, or, I work with kids, so I get sick a lot. And I just wasn't able to get in. And I was finding that was the case with a lot of the offices that were kind of listed in my network. And so then, you just end up at the urgent care. I know all the good ones. I know the fast ones. I know the ones that are open on Sundays. And they were the ones that were able to see me, and my primary care was not.
Finding a primary care doctor was actually kind of difficult for me. And it was me, my auntie, and my sister who are my advocates. We were actually out there like trying to reach out to find one. There were so many of them that said that we're not taking any new people. We looked and we looked and we looked, and the one I have now feels like he actually cares, because we actually had a conversation where he actually got to know what I liked and what is better for me.
No matter who you're meeting with, how straightforward or how complex a person's medical problems are, it takes time to create a trusting relationship. And without a trusting relationship, there's a lot less to gain, I think, from primary care.
I ended up having another stroke, and it was a big stroke. And I was paralyzed on the left side. And I'm still having that problem with my face right now on the left side. But I'm grateful because I got a primary care person, and she really helped so much. It was just so great to have her. And she even asked me if she could be my primary care person. Can she follow me? And I didn't know what that was and what she would have meant at first. And then she explained it. And so I agreed. And I'm telling you, that was a godsend. And I am so glad that I was able to get her. And she found other things that was going on with me. I didn't know I had kidney problems. I didn't know I had bladder problems. She helped with all of that. Now, had I had her at the beginning, I probably wouldn't have had that stroke. I probably would have been able to take care of myself knowing that I had high blood pressure. I didn't know that. I didn't know I had high cholesterol. I didn't even know that I had diabetes. And she helped me with all of that and walked me through so much. And she was so caring.
Community health workers are vital with patients' care because, for one, we identify as members of the community, which helps to build a trusting rapport to be able to work on those long-term chronic health goals. For example, you may have a patient who may be afraid to express a need to their provider. So one of the things that they can do is reach out to me, or I'll reach out to them and support them at their appointments to help them to be able to ask questions and to be able to understand things relating to their health to try to become healthier.
We don't need paperwork, we need people. And primary care is where the people are. And definitely used to be, please do not let the division of medicine disappear.
The direction our healthcare delivery system is moving is unsustainable. And in order to change that, we're going to need to continue the work that we're all doing at a national level, state level, local level, but we're also going to need drastic change. We know that the majority of heart disease and type 2 diabetes is preventable. And I think that work happens in the community. It happens at home, it happens in school, it happens in our kitchens, it happens maybe in the church, but it essentially happens in our community. And how can we as healthcare practitioners enable that? I think that work needs to happen in primary care.
I'm not just a number to him, but I am a person and a patient to him. And they ask me questions. He asks me how I'm doing. He asks me how the things that he's set up for me are doing. He's just to make sure that everything is going how it's supposed to be going. I'm grateful for him and looking out for me as I keep continuing to go through this thing, because it's not easy for me, but I'm doing the best that I can, and he's helping me do the best that I can.